Good afternoon. Good afternoon. Welcome to today's webinar. I'm Mia Tamburi, Program Director at Cancer Bridges and a member of the Education and Outreach Work Group for Cancer and the Environment Network of Southwestern Pennsylvania. Today's presentation is the accumulation of radioactive fracking waste in landfills and its effect on cancer. The speaker series is a project of the Education and Outreach Work Group for Cancer and the Environment of Southwestern Pennsylvania, which is a network of organizations and individuals who are concerned about environmental chemicals and how they are contributing to our region's high rate of cancer. Cancer Bridges is co-sponsoring today's webinar. At Cancer Bridges, we provide support for those impacted by cancer, including counseling, support groups, health and wellness classes, family and youth activities, and much more. Both websites can be found in the chat. If you happen to get disconnected, please log back into the webinar. If you need technical assistance, please send a message via the chat box to Danny Wilson. Her name is listed below in the chat. Also, please enter your questions and comments in the chat box throughout the presentation. Today's presentation is being recorded and will be available on both Cancer Bridges and SenseBob's websites. At this time, I'd like to introduce Dr. Marcia Haley. Dr. Haley is a clinical assistant professor of radiation oncology at the University of Pittsburgh School of Medicine. She specializes in the treatment of breast and gynecological cancers, and her research interests include radiation oncology and public health, in particular the effects of industrial pollution. Thank you, Dr. Haley, for being with us today.
Thank you, Mia, for that nice introduction. I wanted to check and see if I would be doing my own slides or if you would be doing my slides.
Can you share right now, Dr. Haley?
I can. Let me just pull it up here.
I didn't know you were on this. That's cool.
Okay, are you able to see?
Looks great.
Okay, great. All right. Let me just check and make sure that everything is working. Okay. So today, as Mia said, I'm going to be talking about the accumulation of radioactive fracking waste in landfills and the effect on cancer and health. And I do not have any conflicts of interest to disclose. So the outline for today's talk, first I'll discuss definitions and background, then I'll talk about what the problems are, the health risks, and the potential solutions. So before we embark on this talk, it's important to look at some definitions. So the first one is what we mean by radioactive material or radionuclide. That's a material that emits radiation. Excuse me. Radiation is energy released from atoms as particles or X-rays. Radioactivity is when nuclei of unstable atoms transform into other elements by radioactive decay. A picocurie is a measure of radioactivity, and for reference, the EPA drinking water limit of radium is 5 picocuries per liter. Norm is naturally occurring radioactive material. It is considered norm when it's still in its natural state and undisturbed. And T-norm is technologically enhanced radioactive materials that are brought to the surface by human activity. Excuse me. It's important to realize that some level of radiation is everywhere. We live in the Marcellus Shale, which is one of the more radioactive formations. It's the reason we all have to have our houses checked for radon. We all receive radiation as part of our daily lives. On the right, you see a chart here that shows that the mother.
Dr. Haley, We're not
Yes.
seeing the advancement of the slides. I'm sorry to interrupt you.
Oh, you don't see it. Okay, well, let's see here.
We're on the first, the cover slide.
Are you seeing it now?
No.
No, okay, let me, are you seeing it
There,
now?
we're on the outline. Mhm.
Okay, all right, let me pull one. Okay. All right, sorry about that. Okay, so all right, are you seeing the one that says definitions?
No, we're not seeing the slideshow at all now.
Oh. What about now?
No, just Outlook.
Dr. Haley, maybe stop the share and start it again to bring it up fresh.
Okay, I will try that.
So you can stop share on Zoom itself.
Okay, are you seeing anything now?
We see your email.
Oh, that's odd. Okay. All right, stop. Okay, I'm stopping to share.
Yep.
Okay. Okay, now are you seeing it?
Yeah, we're on background.
Beautiful. Yep.
Great. Okay.
Thank you.
All right. Let me go back. Okay, so now do you see definitions?
Yes.
Okay, and then the background. Okay.
Yes.
So looking at this chart on the right, we see uranium, which is the mother element. And then downstream, you can see thorium, radium, radon, and some of the other daughter elements. And what we'll be talking about most today is radium. We've known for many years, excuse me, that radioactivity exists as part of oil and gas operations. According to the EPA, the amount of radioactivity depends on the geologic location and the type of oil and gas operation. So the leachable radium within the rock comes from two distinct sources: the clay minerals that transfer the highly radioactive radium-228 and the organic phase that is the source of the more abundant radium-226. The increased salt level in water produced during fracking draws radium from the fractured rock. And radium emits alpha particles, which, if you remember from high school chemistry, are two protons and two neutrons bonded together, beta particles, which are high energy electrons or positrons, and gamma rays, which are basically X-rays. During the fracking process, operators take fracking fluid, which contains water, sand, and added chemicals, and blast it into the shale, which is miles beneath the earth. The Marcellus Shale, where we are in Pennsylvania, is high in radioactivity. The salty water draws the radioisotopes out of the shale. For about the first 2 months after the well is drilled, flowback is regurgitated. The longer the flowback cycle, the higher the concentration of salts, metals, and radioactivity. Once gas is coming out, then the liquids are called wastewater, also known as brine or produced water. This produced water is 25% solid, consisting of clays, mud, and drilling cakes. Filter socks are sometimes installed at pumps and delivery stations where tanker trucks offload wastewater into storage tanks. Solids build up in the filters and can contain high levels of radioactivity. These filter socks often end up in landfills. Drilling generates mud and sludge, which is contaminated with drilling chemicals such as lubricants. Historically, excess fluids and drill cuttings were spread on the project site and backfilled. However, there were instances where this caused contamination of the groundwater. More modern solutions use absorbent sludge solidifiers. This, however, doesn't take care of the problem since you still have to find a place to dispose of it. The waste is transported by truck to landfills. Then when the rainwater filters through the waste, it draws out the chemicals and the radiation. This is called leachate. And then this leachate, which is the water draining from the landfill, is sent to water treatment plants. And on the right, we see a diagram of the basics of how this works. About 80% of drilling waste stays within Pennsylvania. The problem is that the Clean Water Act's guidelines were developed before fracking even existed, and many of the water treatment plants that are receiving this leachate are not properly equipped to treat this type of wastewater. When the trucks come to the landfill, they are measured for radioactivity. Testing is performed on the trucks, which can detect gamma radiation, but not particulate radiation. The Pennsylvania DEP limits how much T-norm can come into a landfill. However, for many years, no one was tracking how much T-norm was leaving the landfill in the form of leachate. The alarm sounded in 2019 when the Belle Vernon treatment plant was shut down because leachate from the Westmoreland landfill was harming the environment and harming the equipment, the environment of the wastewater treatment plant. Independent testing showed that the leachate coming from the landfill measured 50 picocuries per liter. If you remember that the legal drinking water limit is 5 picocuries per liter. The discharge from the treatment plant showed 8 picocuries per liter of radium, and this was being discharged into the Mon River. In 2019, researchers from Duquesne tested the leachate from the Westmoreland landfill and found elevated levels of radium up to 250 picocuries per liter, which is quite high. So when the leachate is sent from the landfill to the water treatment plant, how much radium is removed? The answer is not much. The treatment plants tested in the DEP T-norm study that we'll discuss a little bit later that are accepting oil and gas wastewater only lowered the radium content on average by around between 9 and 70%. In some cases, the radium content is actually higher after going through the treatment plant, which could be due to accumulation in the equipment. Here's a list of some of the radium readings. And you can look here and see that the influent radium is what by influent, we mean that it's coming from the landfill to the treatment plant. And you can see these numbers are very high. One is 10,000 picocuries per liter. That's extremely high levels of radioactivity. And then the effluent radium is what comes from the wastewater treatment plant out to the water in the creeks, et cetera. And in some cases it's lower, but in some cases it's even higher, such as in this Terra Aqua resource management one. These findings are not surprising in light of previous research. In 2013, researchers measured radioactivity downstream from where the treatment facilities were discharging. They found that radium levels in stream sediments at the point of discharge were about 200 times greater than the upstream and background sediments and above radioactive waste disposal threshold regulations. The authors concluded that this posed potential environmental risks of radium bioaccumulation in localized areas of shale gas wastewater disposal. And you can see on this chart on the right, on the left, you have the upstream and background measurements. And then on the far right, you have the areas where they took the samples near the effluent discharge and that had the higher levels of radiation. We've also seen these types of numbers in the DEP's own data. In 2016, they published a study looking at T-norm in various parts of the oil and gas infrastructure. As you can see from this chart, the levels of radium and leachate are well above the legal drinking water limit of 5 picocuries per liter. And if the treatment plants aren't equipped to filter this out, then it's going into the waterways. When the DEP released its T-norm study in 2016, it told the public there is little potential for harm to workers or the public from radiation exposure due to oil and gas development. However, you have to read the fine print when it comes to the waste products. DEP states that there's a potential for leachate from landfills that accept oil and gas waste to contain T-norm. They found over 350 picocuries per liter in leachate and felt that this had the, quote, potential for radiologic environmental impact. So why should we be worried about radioactivity getting into our drinking water? Exposure to radium over many years can result in an increased risk of some types of cancer, particularly bone cancer. Higher doses of radium have been shown to cause effects on the blood, eyes, and teeth. You've probably all heard of the radium dial workers in the early 20th century. These people worked with radioluminescent paint and had significant exposure to radium, even ingesting it when they used their mouths to sharpen the paintbrushes, as shown in this photo. This resulted in high rates of bone cancer. This is because radium has an affinity for bone similar to calcium. The radium workers were part of the 1 million-person study looking at health effects from chronic low doses of radiation. The program was terminated in the 1990s due to lack of funding. However, there has recently been renewed interest in this topic. In 2016, an analysis by the CDC indisputably linked oil and gas worker cancers to radioactivity exposure received on the job in Louisiana. So the next logical step upon hearing all this information is to ask, since we know radium can cause health problems and it's being discharged into the waterways, how in the world is this able to happen? The answer is that there are failures on multiple levels. The first level is federal. So in 1980, Congress amended the Resource Conservation and Recovery Act, which deals with waste, to exempt wastes associated with oil and gas exploration and production from hazardous waste regulation under the hazardous waste title, creating a huge loophole for the industry. So basically they're saying that the hazardous waste is not hazardous. The Atomic Energy Act is primarily concerned with the fission process and nuclear fuel used at nuclear power plants and does not oversee naturally occurring radioactive materials, including T-norm. The Safe Drinking Water Act establishes categories for the injection of wastewater into underground wells. However, because the RCRA doesn't categorize oil and gas production waste as hazardous, the tighter rules don't apply. Things are problematic at the state level as well. In 2011, the Corbett administration called on the industry to voluntarily end the practice of sending produced water to treatment plants. In 2016, the EPA formally banned the practice. EPA said that fracking wastewater contains contaminants and T-norm can be harmful to human health, and that treatment plants are not typically equipped to handle fracking waste. It can end up being discharged untreated from plants into waterways, which we have seen. It can inhibit the plant's biological treatment of regular waste. It can accumulate in sewage sludge, and it can facilitate the formation of harmful byproducts. However, these rules apply to produced water, not leachate. Lack of communication worsens the problem as well. In order for a landfill to create and ship leachate, the EPA requires a National Pollutant Discharge Elimination System, or NPDES permit. Once the leachate leaves the landfill and is trucked to the sewage authority, a new permit is approved by the DEP. This takes the liquid out of DEP's Office of Oil and Gas Management and place it inside the Solid Waste Management Department. So landfills deal with the waste management and treatment, and the treatment plants deal with the clean water division of the DEP, resulting in a lack of communication. Historically, the Department of Health has been less than helpful when it comes to fracking. In 2014, Pennsylvania Department of Health employees were reportedly instructed not to respond to citizens who contacted them regarding health concerns related to fracking. Staff were instructed instead to refer fracking calls to a different department if the complainant used certain buzzwords such as fracking, Marcellus shale, and drilling. Field staff were also required to obtain permission to attend any meetings outside of the department related to natural gas. More recently, our former Secretary of Health, Dr. Rachel Levine, stated that the Department of Health cannot respond or take action on impacts from oil and gas until they confirm the health impacts are linked to oil and gas activities, And this would take hundreds of complaints to their office to warrant a statewide response. So what can be done to fix the problem? And this is broken down into 5 sections: awareness, legal, legislation, academic support, and advocacy. The first step in providing solutions to the problem is awareness. And I think over the past 5 years, we've seen a relatively large number of publications in different types of print, everything from scientific journals to popular magazines. The most comprehensive deep dive into the topic of radioactive fracking waste has been done by Public Herald, and I encourage anyone who is interested in learning more about this topic to look up their series on TNORM. When DEP released the TNORM study, the locations of the testing sites were not initially released. In 2022, Public Herald released the locations of the 144 sites. On this map, you can see the landfills, centralized waste treatment facilities, publicly owned treatment works, zero liquid discharge facilities, brine-treated roads, well pads, and the test results for radium from the DEP study. In 2021, the DEP began requiring landfills to test their leachate for radioactivity. However, this data have not been released publicly. Also, the DEP is not tracking the volume of leachate leaving the landfill, so there is still work to be done. In 2020, the Pennsylvania Attorney General found that Pennsylvania failed to protect its citizens during the fracking boom. This report called for new laws to protect water samples and manage air pollution, as well as a cleanup at the Department of Environmental Protection. Of the 8 recommendations made, 2 are pertinent to our current topic: requiring safer transport of the contaminated waste created from fracking sites, and conducting a comprehensive health response to the effects of living near unconventional drilling sites. Unfortunately, most of the recommendations have not come to fruition yet, but having a public accounting of the industry by the AG's office was a huge accomplishment. On the legislative front, Representative Innamorato and Senator Muth introduced legislation to repeal the language under Title 58 that exempts the oil and gas industry from complying with the provisions of the Solid Waste Management Act. It also includes drilling waste in the definition of hazardous waste and would also subject oil and gas waste to testing before it is accepted in or released from municipal and sanitary landfills. Over the past 10 years, academics have amassed a huge amount of information on fracking and radioactivity. The Pitt DOH study received $2.5 million from Governor Wolf and is ongoing. Phase 1 of the Wayne State PSR study, which I am involved in, is complete, but there is much more research to be done. And we have the historical studies from Duke and other academic institutions, which is also supported by media publications. So the problem is large, it's quite overwhelming, multifaceted, and it can be discouraging, but there are some things that individual people can do. You can inform your legislator of the problem, show them the data, especially if you live in one of the areas that this is happening. You can meet the legislator in person, by email, write a letter, and always make sure that you participate in the voting process. If you belong to a nonprofit environmental organization, make this a priority agenda item. Help groups that are already tackling the problem. Since we live in Pennsylvania, there are many groups to connect with. Subscribe to Public Herald and become a supporter. Ask Governor Shapiro to implement the recommendations that he outlined when he was the Attorney General. Ask the Governor and the Attorney General to hold government agencies accountable when they do not serve their intended purpose. For example, there are longstanding culture problems at the DEP and DOH that allow these problems to continue. And until we address a lot of these underlying problems, the issue will continue to be unsolved. So I thank you for listening to my talk, and I will answer any questions you may have.
Thank you, Dr. Haley, for that wonderful presentation. Before we turn to questions from the participants, I wanted to say that we have Dr. John Stoltz with us as well. He's the director of the Center for Environmental Research and Education and a professor at Duquesne University. Dr. Stoltz's research is also monitoring the impact of shale gas extraction on private wells and groundwater in southwestern Pennsylvania. Dr. Stoltz, if you could unmute yourself and turn your video on, I wanted to see if you had any reflections on Dr. Haley's presentation and or any additions to the theme she's raised, or concerns or challenges that you've encountered in your research. And while Dr. Stoltz is speaking, you guys can put your questions in the chat.
So thank you for the opportunity, and Marcia, very nice job. And I think you summarized the issue quite nicely. Again, the trying to get some of the data that isn't, that's independently measured has been very, very difficult. And it's nice to see that the DEP has started this program for having the landfills that are taking this oil and gas waste to start monitoring their leachate for radioactivity. But once again, it is absolutely critical that it also be done by independent researchers. One of the things I did want to ask Marcia to start things off is one of the things that I've been rebutted against or for is, kind of comparing exposures to picocuries, if you will. And, we're being told that, well, as you had mentioned earlier, when you go outside, you're being irradiated. If you have radon in your house, you're being exposed to radioactivity. So what's the big deal? And unfortunately, we see these numbers and we're concerned. I see it from the perspective of an academic. And, if we use any sort of radioactive materials in our research, we have to account for every picocurie, not only how much we order, but how it's used and how it's disposed. And anything that comes into contact with that has to be disposed of appropriately. And yet we have this cavalier attitude that it's okay if we put it, in these landfills. So I guess the question that I would ask Marcia to start things off is just how much of a risk is it in these landfills? I mean, for the workers and with the discharge as well.
Well, I think the numbers in the DEP's own study tell us that it's a huge risk. Unless we put a dosimeter on a worker, we don't really know. But you can assume if, you have tons and tons of this waste in landfills and we're seeing it, it leach out into the leachate that's, showing us tens of thousands of picocuries that, the stuff is highly radioactive, and we're not monitoring the workers that work at the landfills. We're not monitoring the DOT drivers that are bringing it to the landfill. They're not wearing dosimeters because I did approach the DEP about that. The numbers don't lie, and it's their own data. And, these numbers are way, way above what is considered acceptable and safe by EPA standards. So, I just don't see how you could argue that this is safe. And, the banana giving the radioactive potassium is a favorite argument, and it just doesn't hold water in this situation. We're talking about orders of magnitude more radiation.
Yeah, I would add one more point, and that is it's not just the radium-226, it's the decay chain, if you will, because the radium-226 decays to radon-222, which decays to things like lead-210 and polonium-210. So basically, and this was a study that was done back in 2014, you seal up some of this waste and let it sit around for 2 weeks and it's 5 times as hot because of the buildup of the daughter products. So again, this is something that it definitely needs to be addressed. And unfortunately, and the subject of today's presentation, this is going to sanitary landfills. They're not hazardous waste landfills. They also take this material as well, but it's going to sanitary landfills.
Yeah, as far as the daughter products, we looked at those in the Wayne State study and did find some elevated levels of lead-210 and polonium in some of the samples near, oil and gas sites. So you're right, it is definitely a concern, not just for the radium, but for the daughter products.
I see a raised hand. Nate, do you?
Yeah, I can talk. And my name is Nate Burden. I'm actually a nuclear physicist. I used to work at Beaver Valley Nuclear Power Station, did radiation control, all that good stuff there. My concern would be really in the vectors of ionizing radiation is normally alpha radiation is not going to go very far, but the big deal is when it is inhaled or ingested, depending on what the radioactive chemical is, such as radium, which has a half-life of 1,600 years, and that's what Madame Curie basically died from. It's basically radium is a bone seeker. I would be curious, especially with gross alpha in the drinking water, the concern about inhalation and studies on publics. Is there any indications or studies of bone cancer, or even looking at the lead-210, which has a half-life of 22 years? So those are the things that would be of great concern for drinking water, is inhalation of these type of radioactive materials and the half-lives that are associated with them.
Yes, so you're right. Both the ingestion and the inhalation are a big problem. And with the drinking water, because, you're also talking about showering, things like that, where it can be aerosolized. The issue is, we have a couple things working against us. Number one, we haven't studied it. We don't have data. So, there's a big missing piece there. And the PIT DOH study is supposed to be looking at health risks associated with fracking, but whether they're going to study radioactivity specifically is not clear. And we don't have any preliminary data on that study. The second thing is the latency period, as you know, for malignancy, is up to 20 years for radiation. So, it takes time to gather this data. And again, we just don't have it at this point, but it definitely is a big clinical concern.
And the other point would be with the radiation model called the linear non-threshold model, the radiation exposure is accumulative. So from any kind of built environment, those exposures are additive. And then what makes it more difficult is the latency period, depending on your genetic disposition and other issues, can be quite lengthy, all the way up to 20 or 70 years, depending on what the exposure vectors are.
Yeah, it's definitely a difficult subject to study and to get data on, and takes a long time to collect the data, and you need a lot of patience. So yeah, it's a tough research topic.
A question in the chat, Dr. Haley, what kinds of cancers were experienced by the oil and gas workers in LA?
That's a really good question. I would have to look at that. I'm not sure exactly what type of cancers they were.
Another, in the past, drinking water has been tested for radium every 9 years, as it is not expected to change if radium is not in nature near the surface. We're now bringing it up and spreading it around. Should this change? How often should it be tested for? Can it be remediated by public water treatment plants?
As far as the remediation by public water treatment plants, the data that we've seen from the DEP as revealed in the Public Herald investigation, we're not seeing it being treated effectively by the water treatment plants. In my presentation, I noted that between 9 and 70% of radium can be filtered out in certain cases, depending on the capabilities of the plant. But in some cases, it even concentrates the radioactivity, possibly due to accumulation in the equipment. So that, as Dr. Stoltz said, this should be going to a place that's specifically designed to take care of this type of waste, and a water treatment plant is not the place to do it. And for the second one, how often should we monitor for radium in the waterways? I would probably defer that to Dr. Stoltz, being a water analysis expert.
Yeah, thanks for the pass. Yeah, well, it turns out the only thing that we really are looking for and to be aware of are if you're downstream, you're a water authority that's downstream from a nuclear power plant. That's the mindset. There's no reason to believe that there should be radium in the water. So it turns out that, most drinking water authorities need to test only once every 9 years. And if they do find something, then that bumps up to every 3 years. And then if they get a clean bill of health after the 3rd year, then it's 6 years and then back to the 9-year schedule. So they're really not monitoring this for any given reason. And yet, because of what we've discovered over the last 15 or so years, is that this waste from the brines, essentially from oil and gas activities, is winding up in our surface waters. It is accumulating in the sediments in the river systems. And it does continue to build up and accumulate because, again, things like radium tend to stick to the sediment. So we have some preliminary data that we've been trying to get published where we definitely see a trend in higher levels of radiation downstream from discharges as compared to upstream. So even though the numbers aren't, of great concern, it's showing that if we continue to use this practice and these, discharges continue, that it will eventually build up to potentially be a problem. I see a question that said, can you discuss what would happen if the leachate is evaporated? That's one of the things that my group did based on the results that we had from the Westmoreland discharge. We found 650 picocuries per liter of total radium in their leachate, and their evaporation system was going to reduce the volume by 95%, and they were producing, and are still producing, anywhere from 100 to 300,000 gallons a day. So when you reduce that volume, if it stays in the liquid phase, you're talking about going from hundreds of picocuries per liter to tens of millions of picocuries per liter. So it is a great concern. So it limits how they're actually able to handle their leachate.
Another comment in the chat, Pitt Department of Health studies have been completed for several months. Publications of the results have been delayed by the Department of Health without public explanation. Dr. Haley, do you have any comments on that?
The last I heard was that they had a town hall in the fall of 2022 to provide a preliminary update for the study. The Department of Health and Pitt, neither one attended that because they said they did not have any data to report. And that's the last I've heard.
Thank you. All right, I think we've answered all of the questions. Does anybody have any last ones before we wrap up? All right, well, thank you, Dr. Haley and Dr. Stoltz, for answering the questions and the presentation. We do have an upcoming webinar on May 4th. It will be on pesticides and the environmental and health impacts on children and workers. So be looking to register for that one. And if you'd like more information about getting involved with Cancer and Environment Network of Southwestern Pennsylvania, you can go to their website, which I believe is in the chat, but it's senspod.org. So that concludes our webinar today. Thank you, everybody, for your patience and for attending.